What I'm about to show you could save your life, and I need you to understand something right from the start. Right now, as you're watching this, millions of seniors are walking around with clogged arteries, and they have absolutely no idea. No chest pain, no warning signs, nothing. And then one day, without any notice, they have a stroke or a heart attack that changes everything. I'm Dr. Sandra Whitmore, and I've been a cardiologist for 23 years, and what terrifies me most is how many of these catastrophic events could have been prevented if people had known about one simple test. A test you can do right now, in your own home, with nothing more than a basic blood pressure monitor. But here's what almost nobody tells you. This test isn't just about taking your blood pressure. It's about comparing pressures in a way that reveals something your regular blood pressure reading completely misses, something that can detect blockages before they become deadly. And when I show you exactly how to do this test in just a few minutes, you're going to understand why cardiologists consider it one of the most powerful screening tools we have. But I'm getting ahead of myself because before I can show you this test, you need to understand what's really happening inside your arteries right now and why traditional warning signs fail so many people. Let me tell you about Robert first, because his story is going to reveal something that almost no one understands about clogged arteries, and it's going to show you why waiting for symptoms is the most dangerous mistake you can make. Robert was 71, active, healthy, walked 3 miles every single day. No chest pain, no shortness of breath, no leg cramping, nothing that would make him think anything was wrong. His doctor checked his blood pressure at his annual physical. Perfect. 128/76. His cholesterol was slightly elevated but not alarming. Everything looked fine. 6 weeks later, Robert collapsed on his morning walk. Massive heart attack. By the time the ambulance arrived, it was almost too late. They rushed him to the hospital, performed emergency surgery, and discovered that 3 of his major coronary arteries were more than 80% blocked. 3 arteries, 80% blocked, and he'd had absolutely zero symptoms. How is that possible? Here's what Robert's cardiologist, who happened to be a colleague of mine, discovered. And this is critical for understanding why this at-home test matters so much. Arteries don't just suddenly get blocked. It's a gradual process that happens over years, sometimes decades. Plaque builds up slowly, layer by layer, narrowing the passage where blood flows. But here's the thing. Your body is incredibly adaptable. As one artery narrows, other blood vessels can compensate. They expand slightly. They create tiny collateral pathways. Your heart works a little harder, and you feel nothing. No pain, no discomfort, no warning at all, until the blockage reaches a critical point. Until that compensatory system can't keep up anymore. And then suddenly, catastrophically, everything fails. But here's what makes this even more frightening. The arteries that supply your heart aren't the only ones affected. If you have plaque building up in your coronary arteries, you almost certainly have plaque building up in other arteries throughout your body. Your legs, your neck, your brain. It's called systemic atherosclerosis. And it doesn't just affect one area. It affects your entire vascular system. And this is where the test I'm about to show you becomes absolutely critical. The test is called the ankle brachial index, or ABI for short, and it's based on a simple principle that reveals something profound about your arterial health. The principle is this. In a healthy person, the blood pressure in your ankle should be equal to or slightly higher than the blood pressure in your arm. Think about that for a moment. Your heart is pumping blood. That blood travels down through your arteries to reach your feet. If those arteries are clear and healthy, the pressure at your ankle should be just as strong as the pressure at your arm, maybe even a bit stronger. But if there are blockages anywhere along that pathway, if plaque is narrowing those arteries, the pressure drops. The blood can't flow as freely, and by the time it reaches your ankle, the pressure is measurably lower. That difference, that ratio between ankle pressure and arm pressure, tells us something incredibly important. It tells us if your arteries are clogged. And here's what makes this test so powerful. Research has shown that people with an abnormal ABI have a dramatically increased risk of heart attack and stroke, even if they have no symptoms at all. Studies have found that an abnormal ABI is actually a better predictor of cardiovascular death than traditional risk factors like high cholesterol or high blood pressure alone. Let me say that again because it's that important. This simple test, comparing the pressure in your ankle to the pressure in your arm, can predict your risk of dying from a heart attack or stroke better than many of the standard tests your doctor runs every year. And you can do it at home with a blood pressure monitor you probably already own. Now, before I show you exactly how to perform this test, I need to tell you about the 7 warning signs that should make you do this test immediately. Because while many people with clogged arteries have no symptoms, some people do have subtle signs that they're ignoring or misinterpreting. Warning sign number 1 is leg pain when walking that goes away with rest. This is called intermittent claudication, and it's one of the most specific signs of arterial blockage in your legs. The pain typically starts in your calf muscles after walking a certain distance. Maybe it's 2 blocks, maybe it's half a mile. The distance is consistent. You stop, you rest for a few minutes, the pain goes away. You start walking again, it comes back. This isn't arthritis. This isn't muscle soreness. This is your leg muscles literally crying out for oxygen because the blocked arteries can't deliver enough blood during activity. If you have this symptom, you need to do the ABI test today, and you need to see a vascular specialist immediately. Warning sign number 2 is one leg or foot that's consistently colder than the other. Temperature difference between limbs is not normal. If your left foot is always cold while your right foot feels warm, that's a red flag. Cold temperature means reduced blood flow. Reduced blood flow means arterial blockage. Don't ignore this. Warning sign number 3 is changes in skin color or texture on your legs or feet. Look at your lower legs and feet carefully. Is the skin shiny or unusually smooth? Have you lost hair on your legs or toes? Is the skin pale or does it turn a deep reddish-purple color when your legs are hanging down? These are all signs of chronic poor circulation. Your skin and hair follicles need oxygen. When they're not getting it, they change. Warning sign number 4 is wounds or sores on your feet or legs that won't heal. A small cut or blister that should heal in a week or 2 but is still there months later. This is dangerous. Without adequate blood flow, your body can't deliver the oxygen and nutrients needed for healing. These non-healing wounds can become infected and in severe cases can lead to amputation. Warning sign number 5 is erectile dysfunction. Men, listen to this carefully. Erectile dysfunction is often an early warning sign of systemic arterial disease. The small arteries that supply blood to the penis are affected by plaque buildup just like other arteries. ED can appear years before a heart attack. If you're experiencing this, it's not just a quality of life issue. It's a potential warning sign that your arteries are clogged. Warning sign number 6 is leg weakness or numbness, especially when walking or climbing stairs. This isn't just getting older. This isn't just being out of shape. Muscles need oxygen to function. If the arteries are blocked, your leg muscles aren't getting enough oxygen during exertion. They feel weak, heavy, or numb. And warning sign number 7 is diminished or absent pulses in your feet. I'll show you how to check this in a moment. But if you can't feel a pulse on the top of your foot or behind your ankle bone, that's a serious indication of arterial blockage. If you have any of these warning signs, the test I'm about to show you is absolutely critical. But even if you have none of these symptoms, if you're over 65, if you've ever smoked, if you have diabetes, high blood pressure, high cholesterol, or a family history of heart disease, you should be doing this test regularly. Now let me show you exactly how to perform the ankle brachial index test at home. You're going to need a few simple things. First, an automatic blood pressure monitor with a standard cuff, the same one you use to check your blood pressure normally. Second, a place to lie down flat. Your bed or a couch works perfectly. Third, 15 minutes of uninterrupted time. Fourth, a pen and paper to record your numbers. And fifth, someone to help you if possible, though you can do this alone if necessary. Here's the complete step-by-step protocol, and I need you to follow this exactly because precision matters. The accuracy of this test depends on proper technique. Step 1 is preparation. Remove all clothing from your arms and legs. No rolled up sleeves, no pants bunching around your ankles, nothing. You need complete bare skin access to your upper arms and lower legs. Empty your bladder. Lie down flat on your back on a bed or couch and rest for 10 full minutes. This is not optional. Your body needs time to reach a true resting state. During these 10 minutes, stay completely still. No talking, no phone, no TV. Just rest quietly. This allows your blood pressure to stabilize and ensures accurate readings. Step 2, measure your arm pressure. After 10 minutes of rest, without sitting up, reach for your blood pressure monitor. Place the cuff on your upper right arm, making sure the cuff is at heart level while you're still lying down. The middle of the cuff should align with the center of your chest. Take the reading. Write down both numbers, the systolic, that's the top number, and you can ignore the diastolic, the bottom number, for this test. We only need the systolic. Let's say your right arm reading is 130. Wait 2 minutes. Keep lying down. Then repeat the exact same process on your left arm. Let's say your left arm reading is 128. Write it down. Now you have both arm pressures. Step 3 is the critical part. Measuring your ankle pressure. This is where the magic happens. This is where we discover what's really going on in your arteries. Take the blood pressure cuff and place it around your lower leg, right above your ankle. The cuff should be positioned so the bottom edge is about ½ an inch above your ankle bone. Make sure it's snug but not too tight, just like when you measure your arm. Now here's the key. The cuff needs to be at the same level as your heart. Since you're lying flat, this should happen naturally. Your ankle and your chest are roughly at the same level when you're horizontal. Press start on the monitor. The cuff will inflate, then slowly deflate. You'll get a reading. This is your right ankle systolic pressure. Let's say it reads 120. Write it down, wait 2 minutes. Then measure your left ankle the same way. Let's say it reads 125. Write it down. Step 4 is calculating your ABI. This is simple math, but it tells you everything. For each leg, you're going to divide the ankle pressure by the higher of your 2 arm pressures. So in our example, your arm pressures were 130 and 128. The higher number is 130. Your right ankle pressure was 120. You divide 120 by 130. That equals 0.92. That's your right leg ABI. Your left ankle pressure was 125. You divide 125 by 130. That equals 0.96. That's your left leg ABI. Now let me tell you what these numbers mean, and this is where everything comes together. A normal ABI is between 1.0 and 1.3. This means the pressure in your ankle is equal to or slightly higher than the pressure in your arm. Your arteries are healthy and clear. Blood is flowing freely. If your ABI is between 0.9 and 1.0, that's considered borderline. It's not immediately dangerous, but it suggests early arterial changes. You should share this with your doctor and consider lifestyle modifications. If your ABI is between 0.7 and 0.9, you have mild peripheral artery disease. Blockages are present. They're affecting blood flow. You need to see a vascular specialist. You need treatment. This won't get better on its own. If your ABI is between 0.4 and 0.7, you have moderate peripheral artery disease. This is serious. The blockages are significant. Without treatment, you're at high risk for heart attack, stroke, and even amputation. And if your ABI is below 0.4, you have severe peripheral artery disease. This is a medical emergency. You need immediate evaluation and intervention. But there's one more number I need to tell you about, and this one surprises people. If your ABI is above 1.4, that's actually not good either. Wait, you're thinking, isn't higher pressure better? No. An ABI above 1.4 suggests that your arteries have become stiff and calcified. They're so hardened that the blood pressure cuff can't compress them properly. This happens most often in people with diabetes or advanced age. Calcified arteries are a major risk factor for cardiovascular events. If your ABI is above 1.4, you also need to see a specialist. Now, here's what makes this test so powerful, and this is what Robert's doctor discovered too late. If you have an abnormal ABI in your legs, you almost certainly have arterial disease elsewhere. Your leg arteries and your heart arteries are part of the same system. They're affected by the same process. Plaque doesn't just pick one location. It develops throughout your arterial tree. Studies have shown that people with peripheral artery disease, detected by an abnormal ABI, have a 20 to 60% chance of having significant blockages in their coronary arteries, even with no chest pain or cardiac symptoms. Think about what that means. This simple test of your ankle and arm pressure is actually screening your entire cardiovascular system. It's detecting systemic atherosclerosis before it kills you. Let me tell you about Dorothy, because her story illustrates why this test matters so much and why I'm so passionate about teaching people how to do it. Dorothy was 68, diabetic, slightly overweight, but generally felt fine. She watched one of my videos about cardiovascular health and decided to try the ABI test at home. She measured carefully, followed all the steps, and calculated her results. Right leg, 0.72. Left leg, 0.68. Both well below normal, both indicating moderate peripheral artery disease. She'd had no symptoms, no leg pain, no foot problems, nothing. But the numbers didn't lie. She made an appointment with a vascular specialist. They did an ultrasound. Significant blockages in both legs. Then they did a cardiac workup. 3 coronary arteries with 60 to 70% blockages. Dorothy was a ticking time bomb and she had no idea. Because of that home test, because she caught it early, they were able to treat her. Medications to reduce plaque progression, a stent to open the worst blockage in her heart, careful monitoring. 3 years later, Dorothy is doing great. Still walks every day, manages her diabetes carefully, takes her medications. But here's what her doctor told her. If she hadn't done that home test, if she'd waited until she had symptoms, she probably would have had a massive heart attack within 2 years. The test saved her life. Now, I need to show you 3 additional tests you can do at home that complement the ABI and give you even more information about your arterial health. Test number 2 is the elevation pallor test. This one is incredibly simple but remarkably revealing. Lie on your back and prop both legs up at a 45-degree angle using pillows. You can lean them against a wall if that's easier. Keep them elevated for exactly 1 minute. During that minute, watch the color of your feet carefully. In a healthy person, your feet should stay the same color, maybe slightly paler, but still pinkish. If your feet turn noticeably pale, white, or even grayish during that minute, that's elevation pallor. It means your arteries are struggling to push blood upward against gravity. After the minute is up, quickly lower your legs and let them dangle off the side of the bed at a 90-degree angle. Now watch what happens. In a healthy person, the color returns immediately. But if you have arterial disease, 2 things happen. First, it takes longer for color to return, sometimes 30 seconds or more. And second, when color does return, it comes back as an abnormally deep red or purple color. This is called dependent rubor. It's your body's desperate attempt to increase blood flow to oxygen-starved tissues. If you have elevation pallor, if you have dependent rubor, you need to see a doctor. These are clinical signs of significant arterial blockage. Test number 3 is the pulse check. You have 2 major pulse points in each foot, and checking them tells you immediately if blood is reaching your extremities. The first pulse point is on top of your foot, called the dorsalis pedis pulse. Sit comfortably with one foot resting on the opposite knee so you can see the top of your foot clearly. Look at the area between your big toe and second toe. Follow that line upward toward your ankle. About halfway between your toes and ankle, you'll feel a slight valley between tendons. Place your index and middle fingers in that valley. Press gently. You should feel a distinct pulse. If you feel nothing, try moving your fingers slightly. If you still feel nothing, that's concerning. The second pulse point is behind your inner ankle bone, called the posterior tibial pulse. Feel for the bony prominence on the inside of your ankle. Move your fingers about an inch behind and below that bone. Press gently. You should feel a pulse there too. Check both feet. If you can't find pulses on both feet, in both locations, that's a strong indication of arterial blockage. Your blood isn't reaching your feet with enough pressure to create a palpable pulse. Now I need to be clear about something. Not being able to find your pulse doesn't automatically mean you have severe blockage. Some people have pulses that are just harder to find because of anatomy or body composition. But it does mean you should do the ABI test and consult with a doctor. Test number 4 is the capillary refill test. This one measures how quickly blood returns to your small blood vessels after being squeezed out. Press firmly on one of your toenails for 5 seconds. The nail bed will turn white because you've pushed the blood out. Release the pressure and immediately start counting. The nail bed should return to its normal pink color within 2 seconds. 1 Mississippi, 2 Mississippi, pink. That's normal. If it takes 3, 4, 5 seconds or longer, that's delayed capillary refill. It means blood isn't flowing efficiently through the small vessels in your feet. This can indicate arterial disease, especially in combination with other signs. Now, here's what you need to understand about all 4 of these tests. The ABI is the gold standard. It's the most objective, the most quantifiable, the most validated by research. But the elevation pallor test, the pulse check, and the capillary refill test give you additional pieces of the puzzle. If your ABI is borderline, but you also have elevation pallor and absent pulses, that's much more concerning than just a borderline ABI alone. These tests work together to give you a complete picture. Let me address some questions I know you're thinking right now. Question 1. How often should I do the ABI test? If your results are normal and you have no risk factors, once a year is reasonable. If you have risk factors like diabetes, smoking history, high blood pressure, or high cholesterol, test every 6 months. If your ABI is abnormal but you're being treated, your doctor will tell you how often to monitor, usually every 3 to 6 months to track progression or improvement. Question 2. Can the ABI test be wrong? Like any medical test, it's not perfect. False readings can happen if you don't rest adequately before measuring, if you measure immediately after exercise, if the cuff is the wrong size, or if your arteries are heavily calcified. That's why technique is so important. Follow the protocol exactly. And if you get an abnormal result, repeat the test on a different day to confirm. If it's still abnormal, see a doctor. They can perform a more sophisticated version of the test using Doppler ultrasound. Question 3. What if I can't get the blood pressure cuff to work on my ankle? Some automatic monitors don't work well on ankles because the anatomy is different from arms. If that's the case, you have 2 options. 1. Try a manual blood pressure cuff with a stethoscope if you know how to use one. Or 2. Skip the home test and ask your doctor to perform an ABI in the office. It only takes about 10 minutes. Question 4. If my ABI is abnormal, what will the doctor do? First, they'll confirm the test with professional equipment. Then they'll likely order additional imaging, usually an ultrasound of your leg arteries, to see exactly where the blockages are and how severe they are. They'll also probably screen your coronary arteries, carotid arteries, and other vessels. Treatment depends on severity. Mild disease is usually managed with lifestyle changes, stopping smoking, starting a walking program, eating a heart-healthy diet, and medications like aspirin or other antiplatelet drugs and statins to slow plaque progression. Moderate to severe disease may require procedures like angioplasty to open blocked arteries or, in extreme cases, bypass surgery. The key is catching it early when simpler interventions can make a huge difference. Question 5. Can I reverse arterial blockages? This is complicated. You can't completely reverse advanced plaque buildup, but you can slow it, stabilize it, and in some cases reduce it somewhat. Aggressive lifestyle modification, stopping smoking, regular exercise, eating a Mediterranean-style diet with lots of vegetables, whole grains, fish, and healthy fats, managing stress, and appropriate medications have all been shown to slow or stabilize atherosclerosis. Some studies have even shown modest regression of plaque with intensive treatment. But the earlier you catch it, the better your chances. Now let me give you the 7 most important lifestyle strategies to prevent or slow arterial blockage. Strategy 1. Quit smoking. This is non-negotiable. Smoking is the single most powerful risk factor for peripheral artery disease. Within weeks of quitting, your circulation begins to improve. Within a year, your risk drops significantly. If you smoke, quitting is the most important thing you can do for your arteries. Strategy 2. Walk every day. Regular walking is medicine for your arteries. It improves circulation, helps develop collateral blood vessels, reduces inflammation, and slows plaque progression. Aim for 30 minutes a day. If you have claudication, walk until you feel pain, rest until it resolves, then walk again. This is called supervised exercise therapy, and it's remarkably effective. Strategy 3. Eat for your arteries. Focus on foods that fight inflammation and reduce plaque. Fatty fish like salmon and mackerel, olive oil, nuts, berries, leafy greens, whole grains. Reduce or eliminate processed foods, red meat, sugar, and trans fats. This isn't a temporary diet. This is eating in a way that protects your cardiovascular system for life. Strategy 4. Control your blood sugar if you're diabetic. High blood sugar damages arterial walls and accelerates atherosclerosis. Keep your hemoglobin A1C below 7%, preferably closer to 6% if you can do it safely. Monitor your blood sugar, take your medications, and work closely with your doctor. Strategy 5. Manage your blood pressure. High blood pressure damages arteries over time. Keep it below 130/80, preferably closer to 120/75. Strategy 6. Take a statin if your doctor recommends it. Statins don't just lower cholesterol, they stabilize existing plaque, reduce inflammation, and significantly reduce cardiovascular risk. If your doctor suggests one, take it seriously. And strategy 7, manage stress. Chronic stress increases cortisol, raises blood pressure, promotes inflammation, and accelerates atherosclerosis. Find stress reduction techniques that work for you. Meditation, yoga, deep breathing, time in nature, whatever helps you decompress. Before we finish, I want to come back to Robert, the man I told you about at the beginning, because there's more to his story. After his heart attack, after his emergency surgery, Robert's cardiologist told him something that haunts me to this day. He said, if we'd known about those blockages 6 months earlier, we could have prevented this entire event. The heart attack, the emergency surgery, the permanent heart damage, all of it preventable if we'd only known. That conversation is why I'm making this video. Because I don't want you to be Robert. I don't want you to be the person lying in a hospital bed wondering why no one told you about the simple test that could have detected this before it was catastrophic. The ABI test is not complicated. It doesn't require special medical training. It doesn't cost hundreds of dollars. It just requires a blood pressure monitor you probably already own and 15 minutes of your time, and it could literally save your life.